We are pleased to welcome you here today to give an update on activity of our clinical affiliation with Johns Hopkins Medicine International. Speaking to you today will be Dr. Michael Richmond, Chief of Staff, and Dr. Mohan Chalapa, Executive Vice President and President, Global Ventures for Johns Hopkins Medicine International. And we will, of course, be happy to take questions at the end. Our duty to Bermuda is to be here 24 hours a day, 7 days a week for medical and psychiatric services. While people can choose where they get their care for many elective treatments, we are the only emergency care provider in over 700 miles, and the only hospitals able to respond to national disasters and mass casualty events. This puts unique pressure on us to have more services, equipment, and expertise available than a similar-sized community hospital anywhere else in the world. To help us deliver what is needed at a high quality, we knew we could benefit from a teaching hospital's depth and breadth of expertise, supporting the training of our clinical staff to ensure excellence in our people, and working with us to improve our services to ensure exceptional care. It is BHB's vision to deliver exceptional care across the Mid-Atlantic Wellness Institute, King Edward VII Memorial Hospital, and Lem Fogo Urgent Care Center. Our vision is to do this through strong partnerships that set the foundation for healthy communities. Strong partnerships can be internal between departments or services or with other local healthcare providers and physicians. But we also knew we could improve our ability to develop and evolve through an affiliation with a high-quality, world-leading hospital. It couldn't be any hospital or academic medical center. We ran a robust and lengthy RFP process, and 6 highly acclaimed hospitals applied and went through extensive review. Johns Hopkins won not only due to their quality and status in the healthcare world, but their deep affinity to and understanding of Bermuda. They have history here. Many patients from Bermuda over many years have experienced their care. Johns Hopkins showed the quality and compassion we were looking for, and I'm excited that we are on this journey to improve on-island care for our families, friends, and the communities, and our community. I'm very pleased to ask Dr. Richmond, our Chief of Staff, to speak about the activity so far and what it promises. Dr. Richmond.
Good morning. Thank you, Vanetta. Signing a contract is a significant milestone, but it was, in a very real sense, just really the first step. The hard work then started. Our first few weeks and months have been very much about Johns Hopkins gaining a deeper understanding of BHB's needs and current practices, and for us both to agree the opportunities for working through and resolving some of these key needs. At the heart of the affiliation has always been ensuring access to quality education for not just hospital staff, but Bermuda healthcare professionals. Our continuing medical education program, which we call the CME program, has always been accredited by an overseas hospital. This is how we assure quality. But now our program will be accredited by one of the world's best known and highly respected healthcare providers. Having an accredited CME program is critical for all doctors who have to work in line with current practices and treatments. Local professional licensing bodies require each person to attend a certain number of CMEs every year. And healthcare professionals across Bermuda benefit from attending BHB's CME presentations. The BHB mission is to deliver safe, high-quality, people-centered, compassionate care every day. So having the staff to do this before anything else is mission critical. But the opportunities extend way beyond this program. We want all our services to be delivered to the highest quality. We want people to feel satisfied with their care and leave us with the best patient outcomes. They must also be efficient so that we can reduce the per capita cost of care. There is an incredible amount of work going on across all of BHB's services by BHB staff to do this. Quality improvement, patient safety, and efficiency are the foundation on which we have worked. This is our 2016 to 2021 strategy, our annual plan of strategic projects, our 2018 quality improvement plan, and the 2018 clinical services plan. BHB's drive to improve is not just about the clinical affiliation. We're not helpless, and we're not entirely reliant on one partner. However, a clinical affiliate is an important cornerstone of this strategy. Johns Hopkins' world-renowned quality of care, experience in global healthcare improvement, and understanding of Bermuda has critical benefits. A rotation at Bermuda Hospitals Board is now offered to doctors in the Johns Hopkins residency program. It has already started in the emergency department. What this means is that some very talented, amazing Johns Hopkins physicians who have essentially completed their medical training and are close to completing their specialist training will spend a month with us. It brings some of the brightest and best into our hospitals. These physicians get to experience healthcare delivery in our jurisdiction, but also bring fresh insights to our teams. We're also working with Johns Hopkins as advisors. We are seeking to improve. Stroke treatment and rehabilitation, for example, is a key focus. We have 4 to 5 stroke cases come to the hospital every week. We want to ensure that we're giving every stroke patient the best possible chance of a full recovery, and also working to identify people at risk even earlier to try and prevent them suffering a stroke in the first place. We're also looking at our psychiatry services for opportunities to improve, or to find more effective ways to structure and deliver our services. Is there a new model of care that we should look at? We look forward to keeping the community updated on all our improvements, and especially how our affiliation with Johns Hopkins is improving care for all our community. Thank you. I will now hand over to Dr. Mohan Chelappa. Dr. Mohan.
Thank you, Dr. Richmond. We are honored to be contributing to the Bermudian health journey. Johns Hopkins Medicine's mission is to improve the health of the community and the world by setting the standards of excellence in medical education, research, and healthcare services. And the unique community of Bermuda holds a special place in our hearts at Johns Hopkins. For more than 2 decades, we have had the privilege of bringing our specialists to participate in the community clinical healthcare education and to care for hundreds of Bermudians at our health system in Baltimore. And let's not forget that the island is home to one of our best and brightest, Dr. Malcolm Brock, who has been a valued member of our faculty for many years. We are delighted to now take our commitment a step further through our clinical affiliation agreement with Bermuda Hospitals Board. We will support the Bermuda Hospitals Board staff with education and training, and together we are now in the process of establishing a stroke center, and the stroke center initiative is led by our top expert of Stroke Center, Dr. Victor Urrutia. Our affiliation also includes a program for Johns Hopkins residents, medical doctors who have graduated from an accredited medical school and are completing additional specialist training at Johns Hopkins. Our residents will complete 4-week rotations to Bermuda to perform short-term clinical and quality improvement projects with the staff of the BHB. The first Johns Hopkins resident, Dr. Ruben Troncoso, recently completed a month rotation at King Edward Memorial Hospital and had a very enriching experience. Our clinical affiliation with Bermuda Hospitals Board is an important part of Johns Hopkins' vision to enhance healthcare around the world by sharing our latest clinical advances and research findings in a way that contributes to local health. And many years to come, we want to enrich this engagement. Thanks for giving us an opportunity to be partners in your healthcare.
I know you spoke to some of the improvements that will happen. Would you be able to speak to some of the challenges now faced that this partnership will address?
Absolutely, Dr. Richmond.
Excuse me. When you say address some of the challenges that this partnership will face, is Johns Hopkins obviously has an enormous reservoir of knowledge, of expertise, and an ability to create value in any health system. And when we say value, it's around being as efficient as we can, and it's around improving clinical outcomes. But obviously, at the beginning of any journey, we have to climb the foothills before we climb the mountain. And so we are endeavoring to focus on one area, and we've talked about stroke care. Stroke care is an obvious area for us, where it's essentially it's an emergency sort of intervention, and as an emergency intervention, we're looking essentially at the first few hours of care to provide care which gives every possible opportunity for as good an outcome as is possible. If we can match their clinical outcomes, this affiliation will have there'll be a return on the investment in spades. And so we are looking to use that as essentially a catalyst for us to broaden the engagement as we go forward. But we're not endeavoring to run before we can walk.
You've spoken about the residency program of the doctors coming down from and spending a month here. I believe the doctor mentioned also training for BHB staff. Can you give us an idea of what that looks like?
So there will be two components. One for our clinical staff, and Dr. Richmond will speak to that again. Another is for our administrative staff at this particular point. So what we've agreed and organized is, in the event that we need to have observerships, we need to have the talents and the competencies of our executive team or higher level leadership developed, then they will have the opportunity to do observerships at Johns Hopkins. So that's a real benefit for us. But again, there's clinical.
Using the template that I was just referring to in terms of stroke care, we are looking to develop our stroke program very much in line with the direction that we are being guided. We have local doctors, we have local experts, and it's not a matter of retraining anybody, it's a matter of if essentially immersing them in current practice, immersing them for short periods of observerships in the environment that is Johns Hopkins. And so it's very much, if you like, an iterative process that we're going through. And all of the local doctors that are slowly being involved in this are extremely excited and engaged in what is doing. Essentially, patients are very much at the center of what we do, and the intent is to create clinical outcomes which are a match with the best of the best. And that is incredibly rewarding for any healthcare practitioner, that they feel that they are part of providing outstanding care and clinical outcomes. So, very exciting.
BHB and King Edward have had ongoing relationships with many different medical centers over the years. How does this deal affect those relationships?
We'll continue to have relationships with multiple care providers. What this does, what we wanted to do was standardize our relationship with at least one provider so that we could get the consistency and the continuity that we needed. We can harmonize between the quality of care that we will get, enhancing our quality of care here, but also being able to put, as I said, some of our team into a Johns Hopkins environment. So what this does not change is where Bermudians go abroad for care. And so it's really important that the collaboration and the relationship that we have with hospitals overseas, all of them, that it continues to be good and there continues to be open dialogue between them. It does not impact where Bermudians are referred to. What this is about how do we get Bermuda, our hospitals, MWY, King Edward, Lem, Fogo, our care at the standard that we want and have that consistently at a high standard. Yeah.
Does this agreement come with a cost factor?
Absolutely. We've disclosed our cost under Patty, so it has been made public. So it is $800,000 a year, and it's a 2-year contract. So definitely it comes at a cost, but Dr. Richmond has talked about the value, and we could speak to it again. It is a cost, but the value outweighs the cost, and it's up to us to make sure that we derive complete value out of the agreement. Yeah.
Doctor, if you can just speak to Johns Hopkins obviously is world renowned. Why get into this agreement with Bermuda?
The objective or the mission of Johns Hopkins is actually to work with highly valuable, highly qualified, highly efficient partners in different parts of the world to share the good practices, to learn from them, and see how together we can really create an impact in the local community's healthcare. And this has been the driving force of Johns Hopkins Medicine and the international arm of it. With that, we have actually both sought out and also reached collaboration with a number of marquee institutions around the world in our belief that Bermuda and the Bermuda Healthcare Board gives us a great opportunity to collaborate together and to bring the best of both the systems to the population of Bermuda, along with the support of the physicians here. And that's the reason why we entered into this agreement.
You mentioned having one of our homegrown on faculty with Johns Hopkins for many years now. Might the opportunity become available for more Bermudian students who wish to get into the medical field to become engaged in the educational side of Johns Hopkins?
Johns Hopkins is certainly interested to pick and select the best from the international medical schools and international schools and to bring them over and then train them and then make them sort of go back to the society or go back and ensure that they are really sort of providing a lot of impact to the countries. And in that respect, we do expect a significant opening of opportunities for us to really evaluate good potential young candidates from here and bring them more as Johns Hopkins candidate. And we want to create several Dr. Malcolm Brocks.
Just one more question. I know you said you would continue your partnerships with the other hospitals referring patients, but with this partnership, would you be able to do more here than you had been able to do before?
This partnership, in the first instance, in the first iteration of the agreement, again, does not speak to where the patients are going to go for care that isn't provided in Bermuda. But to answer your question more directly, yes, I'm sure it is the Chief of Staff's hope, it's definitely my hope, that as we improve and we see opportunities to expand our local services, that we'll be able to do that in a slow and measured way.
Just to add to what Vanetta has just said, is what our ambition is, what the aspiration is, that we're able to provide services on appropriate services on island, which benefit the patients in their local jurisdiction. If we're able to provide those to the highest standard, then the answer to that is, can we cautiously grow some of those appropriate services? What we have to understand is that we are a community hospital, we are a secondary care provider, if you will, and we should continue to provide the services that match that ability to deliver, but we are connected if we need to escalate care to a respected support system. So in terms of growing services, there is potential. Our ambition, though, is to improve the offering that we currently deliver on.